Okay, good day, everyone. Welcome to another episode of One Health Talks. Our guest for today is Charles Adigbole. He is an intern for the One Health Lessons, an organization that develops teaching materials and lessons regarding One Health for adults and children to understand the important link between our health and the health of animals, plants, and the environment. I am Chiqui. I'm one of the core members of the IRT team, and this is my colleague Julian. He's also one
Hi.
of the Yes, one of the members of the core team. So today we will be asking Charles about his interest in One Health and how he became an intern for the One Health Lessons organization. Thank you so much for joining us on our One Health Talks this afternoon or this evening, Charles. I would like to ask by asking you a bit into your background and how you came to be an intern for One Health Lessons.
Okay, thank you so much. Like you rightly said, my name is Charles Adigbole. I'm a Nigerian, and I am currently a veterinary medical student from the University of Ilorin here in Nigeria. So the way the One Health concept came about was it was one of my lecturers in class that mentioned it, briefly. It was not something talked about seriously. So, but from then I had understood the concept of One Health. I had known about things like zoonotic diseases. I had known that disease could affect humans, could affect, animals, and there are things that the environment could also do to impact. Humans can do in environments to impact themselves. So, but the One Health Lessons internship, how it came about, I was on LinkedIn one day, just scrolling through, just looking for, just checking out accomplishments of different people. Then I saw one of my connections. I think it was one of my lecturers had shared the post that Dr. Deborah Thompson made. And I looked at it. It looked interesting. I looked at the requirements. I felt like I could do them, and I applied. So that was how I came about the internship opportunity.
That is very interesting because, in the One Health space or One Health movement, it's not very widespread actually around the world. But we are seeing right now, nowadays, that there is really a need for interdisciplinarity in terms of the environment, human health, and animal health. And incidentally, a major aim of One Health Talks, this particular interview, is to create awareness of the value of One Health to human health as well as the environment or the environmental health. I would like to ask you how you would define One Health. In your opinion, what is One Health and what are you interested about in it?
Well, simply, One Health is the connection between humans, animals, plants, and the environment. And what really interests me about One Health is it exposes the roots of the major health crisis that we're going through. For instance, COVID-19. It's One Health kind of exposes how it came about. Relationship between humans and the environment and the animals. Yes, and what fascinates me more is that One Health is the solution to the problems too, because One Health also encourages collaboration of different disciplines, regardless of whatever field you may be in. So One Health exposes the problem, and it also is the only solution. So why not? Yeah. So that's like what draws me and makes me passionate about One Health, because I feel without One Health, we may not really be able to find a solution to a lot of things we're going through, like COVID-19, rabies, antimicrobial resistance. Everybody just has to, put all hands on deck. Yeah, that's what makes me passionate about it.
That is very interesting. Would you say that one needs a veterinary background in order for them to engage in One Health activities?
Please, can you come again? I did not hear that.
Yes. As you are a veterinary medicine student, would you say that having a veterinary medical background is important in engaging in One Health activities?
Well, for me, it gave me the foundation, but I also think you don't have to be a medical student to know about One Health. One of the things we try to do about at One Health lessons were to train people, volunteers, and we were not using criteria like, are you a medical student or anything like that. I remember when I started training, when I started putting out posts asking for volunteers, calling for volunteers, we had people from law, we had people from engineering filled those forms. And I remember we trained some of them, and it's quite easy to understand. I don't think it's rocket science. It's quite easy to understand that this is the problem and this is the solution. So although it helped me, it exposed me to it. I don't think it has to be a criteria for you to know about the One Health concept and support it passionately. I really don't think so.
Yes, I totally agree. It's not a one discipline activity. You know, everyone will be able to contribute to One Health. Yes, Julian, you're raising your hand.
Yeah, no, just to say that I was also 100% in. Sorry, my French kind of messes with my head a bit. I agree with what you were saying, and just to really push on the concept of interdisciplinarity and to understand that it's important that we involve the other disciplines, because it's based on the knowledge base that we can actually see or have a much richer picture as to what the origin, as you spoke about, of a particular problem or a particular complex problem is. And if we don't have these data, this knowledge from them and their inputs, then we won't be able to have a proper or sustainable solution. Well, I don't really like the word solution. I'll most likely choose sustainable management of the problem, because as we say, if I see a problem, a complex problem, it always has constant, it kind of evolves with time. So which means that the initial solution now might not be the solution in 10 years' time. But by managing and having a flexible, adaptive mechanism put in place, because we have the integration of different knowledge bases, then it helps us to able to really tackle the problem at its core. So I really am 100% d'accord, sorry, 100%
in agreement.
In agreement. Thank you.
Yes.
Sorry, my French, your definition. Thank you so much for that, Charles.
Yes, that is absolutely true. So it's, as I mentioned earlier, it's not a one-sided approach. We would be needing different disciplines in order for us to come to a sustainable management, as you mentioned, of different issues regarding One Health. So I would like to ask Charles, how do you think can multiple disciplines get into thinking about or creating sustainable solutions or management to One Health issues that are, emerging in our society today? So as you mentioned earlier, that COVID-19 is one of the major issues that we are dealing with right now. There are also different environmental disasters or issues around the world. So how can multiple disciplines really get into thinking about a sustainable management regarding these issues?
I think it starts from even creating awareness about it, making them know, because as it stands, not all of them even know about these things. So getting to let them intimate them about these things, that's the first place to start. I think the second thing is brainstorming, where we could, have roundtables, significant roundtables with people from these different fields represented, and brainstorming on different contributions they can make in their own way. If it is to, say, for instance, stop the wrong, say, when it comes to antimicrobial resistance, let's say the security personnel say, okay, this is what they can do to prevent the illegal importation of certain antibiotics into the country, and different people bring their own contributions. I think it starts from letting them know and then brainstorming. Once, all those, they say, two heads are better than one. If all the heads could come together, they would definitely have one or two things that they could do to support the One Health movement and the concept in general. Yeah.
Yes. Yes, that's perfect. And it's not only about the thinking about a solution, but also acting for it and doing action regarding that. So it's very important that there are many heads, as you mentioned, in doing the action. It would be better if everyone is involved with it, so that the work will be done in more efficient manner and more sustainable manner. Now, I would
Yes,
like
and
to
we also need support
yes,
from major agencies, like although the WHO, AFAO, they are all in support, but I feel like more reputable organizations need to embrace the One Health concept, because the more people embrace it, the more legit or valid it seems, and the more people will be more willing to to act
Like
and
it,
do
yes,
something
supportive.
and support. Yes, so yeah.
that is so true.
Sorry for
Yeah,
cutting you off there.
it's okay, no problem. That's why we need more individuals from One Health lessons to help us out in the One Health movement. Yes, that is correct. Now, I would like to ask you, what is the most rewarding thing about being an intern for One Health lessons or doing teaching in the One Health lesson sphere?
Well, I hope, I don't know if this sounds a bit funny, but I think the most rewarding experience I've had so far come from when I was teaching children. The One Health Lessons material is so beautifully designed that it has topics that would help you engage children. And from my different teachings, I've had to, you don't always have the opportunity to engage children every time. Maybe your neighbor's child, okay, well, but the opportunity to engage like 100 children or 80 children at a time and see them smile, joke with them, you don't always get that opportunity. And that little bond, or that temporary bond I shared with them while teaching them, it was very gratifying. For the times I taught, those were like the highlights of my week, my month, and I would not trade it for anything. So I would say the feeling I got from interacting from those children, I know it sounds a bit off, but for me,
Is not
that was just
is
it. And the feeling, and knowing that I was, telling these children something that they may never get to hear, because these things are not in the school curriculum. The government does not really do anything to make sure these children, get to hear it in their. If I didn't study vet medicine, I probably would not have heard about One Health or anything about zoonotic diseases like that. Yeah. So knowing that I was contributing such in a way to children's future was also very, very gratifying for me. So I would say my bond with the kids and the knowledge that I was passing to them was really the thing for me.
Yes,
Yeah.
that is very lovely to hear. I like that. And it's not
honest-
off,
it's not
it's
weird at
yeah,
all.
it's
It's
not weird
awesome.
at all.
Honestly, it's
Yeah,
really
it's awesome,
incredible.
very lovely.
Because I didn't really, I think I kind of understand a bit more the philosophy of One Health lessons and the fact that trying to make sure we impart knowledge to the younger generation, because they, as we say, they're the future. So really starting from that generation and trying to create training materials that are adapted to really engage and motivate children. I think that is a beautiful idea. And to also bring them up in
Mm-hmm.
that understanding of One Health, the concepts, zoonotic diseases at a younger age, so that they can maybe grow up and understand a bit more and really pursue research or education in this sector. So yeah, I think it's a lovely, lovely initiative. And we're just really happy that we're able to meet each of the interns. So
Yes.
thanks so much for that.
Thank you so much for
Yeah.
sharing that as well. It's really nice to hear. And as Julian has mentioned, it is very beneficial for children to know these things even at a younger age, so that they will already build an awareness among themselves, and this awareness can be their inspiration and motivation to pursue you know topics or to pursue research in the One Health field. As we mentioned earlier, that not a lot of people know about One Health yet, so if we start with the younger generation, it would help in increasing awareness and creating action regarding that in the future. Thank you so much again for sharing that with us. It's very nice to hear. Now, I would like to
It's a pleasure.
ask, we are nearing our interview session. I would like to ask, what could be a fun fact about you as a big brother to those children who's doing the One Health lessons? What can you share to us as a fun fact?
As a fun fact about me, Well, there are a lot of things I think I find interesting about myself that are kind of not not the usual thing you would hear from a medical veterinary medical student. Or okay, one of it is I box. I'm a boxer. It's not a professional boxer per se, but I'm really religious about it. I go for trainings and all. And when people hear that you're a veterinary medical student or you're a veterinarian to be and you're also a boxer, it's like, how it's a bit weird. Yeah, so I think that's one thing. You would probably will not know by seeing me, because people would assume like boxing is this violent thing and then medicine is this very calm thing. So how do you how do you drift off to that kind of a place? So yeah, as a hobby, I love to box. Yeah, so that's like one very fun thing that a lot of people usually are surprised about when I tell them, if I tell them.
Yes, it is actually quite surprising, but it also shows that you're very well-rounded. You're not only the intellectual veterinary medicine kind of guy, but also the sports guy. So you're a total, yeah, total package. Julian also boxes, actually.
Yeah.
So it's not
I
for roles.
started I started doing kickboxing here after I finish work, I go and do a bit of kickboxing as well. So yeah, I mean it's good to have that physical sport to. I use it to actually balance off the stress of all the work. I use that time to relax and punch
It's
something.
required.
Cool.
Yes.
It's required. It's necessary.
Yeah. Okay. Great.
Yes, thank you so
Yeah.
much for being here with us and for what you're doing for our individual, individuals who are interested in One Health. Thank you for sharing your experience with the One Health lessons as well and sharing your
It was a
passion
pleasure.
for the children. And yes, so I would like to invite everyone who is watching to visit the One Health Lessons website. You will be learning more about their work there, and also visit their social media. Follow, subscribe if you haven't yet. Also to the IRT social media, which I think we can put somewhere on the screen. Yes. So we will put here the websites, the Instagram pages, Facebook if we have it, YouTube, Twitter, so that everyone will be able to see what One Health lessons and the IRT team are working on. Once again, thank you so much, Charles, for being here with us, and hope to see you
Thank you
again
for having me.
soon and working
Yeah,
with you
sure.
again
I,
soon.
I I had a nice time. So yeah, I'm looking
Yeah.
forward to it myself.
All right. Thank you so much, guys. Bye.
Bye.